But now when I look in the mirror, it's like I'm not looking at a really old lady, I'm just looking at a nice lady.
Welcome back. Each year, millions of people turn to cosmetic surgeons to look and feel their best, and this is just one of the many satisfied patients who've undergone the procedures offered at Skin Speaks Spa MD here in the Twin Cities. Dr. Patrick S. Carney is a board-certified dermatologist and cosmetic surgeon who's been named a top doc by Minneapolis-St. Paul magazine for 6 consecutive years. And this morning, Dr. Carney is here to explain the benefits of having a cosmetic treatment done with local anesthesia. Hi, Dr. Carney. Welcome back.
Thank you.
Let's talk a little bit about the idea that you're both a dermatologist and a cosmetic surgeon. How does being a skin expert work to the advantage of a patient?
Well, Corbin, so many of the procedures that I perform and that the people are interested in today have to do with the skin. Whether it's tightening the skin or removing blemishes and scars, the dermatologist really has the skin as their domain, but yet there's so many other specialties who are trying to take over and say that we are experts too. But unfortunately, no one has the training and expertise that a dermatologist has. So I'm very proud to say that I'm a board-certified dermatologist because we spend 4 years learning the structure and function of the skin, and there's no other specialty that knows the skin like we do.
And that's one point I was going to get to, is this board certification, because that's something we should be looking for when we seek out doctors?
Yes. I'm a board-certified dermatologist and a fellowship-trained cosmetic surgeon. And it gets somewhat confusing because today, whether it's a physician or a medical spa, it will say physician supervised, but unfortunately it's oftentimes supervised by a physician who has no experience or expertise in the procedures that are being offered.
Okay, well, and that is clear. Like you said, there's lots of terms being tossed around, so it's good to have that information. Now, we've got a few of your patients that are going to come on and tell us a little bit about the procedures that they had done and what they thought about it. And we're going to start off with someone who had a facelift.
I did not want to go under a general anesthesia. Every time you do, you take a chance. And I knew that it could be done under local, and I had gone to another doctor and he wanted me to go under general, and I didn't want to do that. I had no qualms about doing it, and when my friend told me about Dr. Carney, I thought, this is my man. I like my results. One of the reasons why I did this was because every time I walked by a mirror or a store window, I would see this old person looking at me. But now when I look in the mirror, it's like I'm not looking at a really old lady, I'm just looking at a nice lady.
I really enjoy the fact that I can open my eyes once again. It was a real effort when your eyelids have expanded, and he did take a lot out, and it worked perfectly. I would definitely recommend Dr. Carney. I feel he did a very good job, and he explained the procedure before, during, and after.
I absolutely love my results. I came into it wanting to have better self-esteem, and I think that's exactly what I gained. Before the surgery, I would wear hoodies all the time, just covering up myself, and it made me respect myself more. And I feel truly better about myself, and that's what matters most.
Now, Dr. Carney, the first testimony was about a facelift, the second about an eye lift, and the third was about liposuction. Dramatic results, particularly in the liposuction. Talk about using local anesthesia, because that's your choice of anesthesia.
Yes, and I believe I'm the only physician here in the Twin Cities that can do all of those procedures under local. For the most part, physicians have been trained to do those under general anesthesia in the operating room. But that certainly adds additional costs. There's the cost of either a nurse anesthetist or an anesthesiologist, the operating room facility as well, and then there's certain risks that are associated with general anesthesia. About 20 years ago, after completing my fellowship, I said to myself, can I do these procedures under local? And sure enough, I developed a technique where I can do a facelift, an eye lift, and any liposuction under local anesthesia to provide cost savings to the patients and safety. And as you can see from the before and after pictures, as well as the testimonials, results.
Yeah, well, it is pretty amazing, and we're going to tell everybody how to get in touch with you, and they can find out a little more information. Thanks for